The other big one is to get a pneumonia vaccine, and this is what pneumonia looks like. Pneumonia means it's an infection in the lungs, and typically this is an X-ray, and your lungs here are black on both sides. That means they have air in them. And what happens if they get infected is they get pus in them, and then they become white like that. So this is a very severe pneumonia. So what's recommended, this is the pneumonia vaccine. There's lots of different types of pneumonia vaccines. All of them work actually quite well. And the recommendation is for anybody who's 65 years or older, or anybody who has certain medical conditions like heart disease, kidney disease, lung disease, diabetes, and you get it once and then after 5 years. And then the last vaccine I'm going to talk about is shingles. So I'm not talking about these kinds of shingles, I'm talking about those kinds of shingles. So shingles is like little blisters. They look like little fluid-filled blisters. So if anybody's seen chicken pox, it actually looks exactly like chicken pox. And the reason it looks exactly like chicken pox is because it's the same virus that causes chicken pox. So once you get chicken pox, the virus doesn't go away after you recover it. It stays inside your body for the rest of your life. And then what happens is that once your immunity starts to go down, that virus comes back and it causes shingles. And actually it's very common. 1 out of 5 people, or 20%, over the age of 65 will get shingles, basically. And the reason that it's so bad, is not that it's hard to treat, or even if you don't treat it, it will get better on its own. It'll go away in almost everybody. But the reason it's so bad is it causes this pain. And even after it goes away, you can still have pain for months and months and months. And for some people, the pain can be crippling. So it's something called post-herpetic neuralgia, and it's a very difficult type of pain to treat. And so this is what it looks like. So you can typically get it like over here, 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 or sometimes in the face. So you can get a vaccine, and the vaccine works reasonably well. It's the shingles vaccine. It reduces your chance of getting shingles by 50%. So it's not a great vaccine, but it works reasonably well. But even if you get shingles, the chance of long-lasting pain is reduced by about 2/3. So that's another advantage of the vaccine. And so the current recommendation is that everyone over 50 should get the vaccine. And the vaccine has a small amount of chickenpox virus that boosts your immunity. A lot of the drug plans cover it, otherwise it's fairly expensive, is the only downside. There is a new vaccine that's currently, the data has just come out, that's about 95% effective, so it looks very effective. And that should come out in about 2 years, probably in Canada anyways. So this is a summary of some travel medications. So normally when you travel, you should, a lot of people will take antibiotics along with them in case they get diarrhea, and then you can take a few days of antibiotics. And then a lot of people will take anti-malarial pills. The most commonly used one is a drug called mefloquine, which you take once a week, starting before you travel and then continuing it after you come back. And then the most important thing is that if you've been to India and you come back and you get a fever, then you should just make sure you don't have malaria. You know, if you get a fever one day and it goes away right away, then don't worry. But if you get a severe fever, especially if it's persistent overnight, then you have to go to emergency basically and get asked, tell them that you went to India and that you should have a malaria smear done. These are my 3 kids, Sapna, Dino, and Sonika.
Thank you, Atul.
Every year when we go for the first week or 2 is quite miserable because we get some kind of virus or infection or something. This year when we went, we had serious problem, and like you said, the family had all kinds of antibiotics and they gave us Ziplocs,
Yeah.
And they gave us some pretty powerful medication after that. The doctor was called, And what it has done, of course, we recovered in about 3 to 4 days, but what it did was to did tremendous amount of damage to our digestive systems. And then we had to take these, what is it called, dahi and
Probiotic.
probiotics
Yeah.
over here.
Yeah.
And it has been 6 months or 5 months, but the system still hasn't quite normalized.
Yeah. So it's a good point. I mean, antibiotics are good. In the old days, before antibiotics, people used to get minor cuts and bruises and they would die, right? They'd get an infection and they would die. So antibiotics are really good, but they have to be used properly. And if they're not used in the right setting, they can have, serious side effects, especially on the digestive system. But also, if you got an infection, if you got a digestive system like a diarrheal illness, that can also have long-lasting effects on the digestive system, and it can. So some of these viral infections, you can get acute stomach flu, and it goes away, but then you get something called irritable bowel syndrome, and that can last for months and months afterwards, and it's called a post-infectious irritable bowel syndrome. So that might also be what happened there.
In our gut, intestine, we have trillion bacteria. Trillion. And most of them, they are good. And they keep the bad one under control. So if you take an antibiotic, kill the good ones. The bad ones then have a party. That's exactly how we relate. Go ahead.
In the
Yes.
40 years that I have been here, just to add on, my family doctor refuses to give me antibiotics over here. In the 40 years, probably he has given me antibiotics about 2 or 3 times at the most. In India, they tend to give it very liberally,
Yeah.
in fact.
Go ahead.
How much faith one can put in homeopathic system because it's not recognized in Canada?
I think homeopathy is okay for minor ailments, and the truth is most minor illnesses will get better on their own. For anything serious, it's much better to use standard medicines and standard healthcare facilities because those are proven. They're based on scientific evidence. So I would actually, to be honest with you, I wouldn't put much faith in homeopathy for anything that's severe, moderate, or very severe.
Any other question? Oh, go ahead.
Yeah, related to what he was telling, why the Indian system that does not regulate the availability of antibiotics?
Yeah, and it's a good question, and I think that they are starting to now. They're recognizing that this is a serious problem, and they will have to, because nowadays almost any patient I see who's had a surgery in India and gets an infection, the infection is resistant to everything. And I see many of those patients, and they're very difficult to treat. The other thing is people think, oh well, the drug companies will invent some new antibiotics, but they're actually not inventing antibiotics because it doesn't pay them. It costs so much to develop an antibiotic. They don't get their money's worth out of it, so they'd rather develop hypertension pills and those types of things. So it's people don't realize how actual serious a problem it is, but I think that will change in India and many other countries as time moves on.
Naveen?
I was in Jaipur about 35 years ago or so, visiting family, and I got dengue fever,
Yeah.
which I had never heard of before. But anyway, I came back and I used to give blood for Red Cross, and they said no, you can't give. I didn't know why they told me you cannot give blood anymore. Could that be the reason? That's one question. The other is how important is shingles vaccine for people who already had chickenpox?
So the first question, the dengue, you can't give blood at least in the first 6 months after you've had dengue, and I don't think the Red Cross will allow it for probably a year or two, because you can transmit it by a blood transfusion in that case. But if it was 35 years ago, that shouldn't be an issue, really.
So I can go again and try?
Yeah. For the shingles, So the shingles vaccine is exactly for people who have had chickenpox before. Because shingles is just chickenpox that's dormant in your system coming back. And so the people who need to get the vaccine are the people who have had chickenpox before. That's exactly the patient population it's meant for.
This is a different type of question. What should be the strategy for a person who goes to India and gets sick? Should he get treated there, or should he catch the next flight and come over here? And then what sort of information you should bring along?
Yeah, I think if you're seriously ill,
Yeah.
you should get treated in India, because usually if you're very, very sick, it's not safe to get on a plane and come back here.
But they treat-
if you
it's
kind of
too
had
much.
kind of this grumbling illness and you're not sure what's going on, and
But they treat you too much of antibiotics and all that. The strategy
no,
of treatment is
I think you have to try to find a good doctor there. As I said, there are times when antibiotics are the right thing to do. If you have a bacterial infection, then you need antibiotics. It's when you have a viral infection that you don't need antibiotics, right? So if you have an illness that's been going on for a while and you're not sure what's going on and you're worried, then it's probably better to come here. If you have that luxury to just come here and get it looked after here. But I think if you're really sick, you have to go to a doctor or a hospital in India.
Ram?
Yeah, you didn't cover typhoid. Is it a medical term you cover we didn't know, or it's not a problem in India?
No, typhoid is definitely a problem. So typhoid is, it's one of those bacterial infections you can get in India, typically from eating contaminated food. So you should get, typically what's recommended is a typhoid vaccination before you go to India.
Chandramouli?
Can shingle attack you more than once?
Yes, shingles can attack you more than once. So about a quarter of people who have had shingles will get a second episode of shingles. So the main, don't worry. The main thing with shingles though is if you get shingles and you can get started on treatment, there's actually very good drugs to treat it, but if you can get started on treatment within 24 hours or 48 hours at the latest, your chances of having that pain are much, much reduced. But if you wait over 48 hours, then the treatment doesn't really do very much.
Do we allow Jagmohan to ask a question? No. You can ask a question at home.
I read in the newspapers that when the Canadian soldiers who went to Somalia, they had this mefloquine given to them and they became senile, or they lost their brains. So how true is that?
So the question is about mefloquine, and so that is a side effect of mefloquine. It's called neurotoxicity, and typically what it causes is very vivid dreams. Is the most common thing. So you have to be aware of those types of side effects, and if you get them, and they're significant, you have to stop the mefloquine basically, and it resolves after you stop the mefloquine.
Yeah, actually, I have a curiosity. Once I had malaria, I went to India after 1 year. Can parasite be there after 1 year?
Yeah, so there are different strains of malaria, and certain ones, particularly the ones you get in India, once you get it, it then lies dormant in the liver. So you can get it again and again, and you can even get it a year after you've been to India. There is a way to treat that dormant phase, but it's a separate set of pills that you need to take for it.
No, but I never had malaria when I was there.
Yeah, so typically you get infected there,
Yeah.
but you don't get symptoms. It doesn't start till you come here.
Yeah, it came out.
And it can come even after a year if it's that one that becomes dormant in the liver.
Linda?
I just want to make a comment in response to the question here, whether you should be treated in India or you should come here. 3 times on my flight, I had to divert the flight to stop at different countries because the person got so sick. And one time we had to resuscitate, he kept him alive to get at Tel Aviv. So before anybody decide to come over, think of that you are going to be in a plane with no medical equipment, because the first time wasn't, so I wrote to Air Canada what they should have in the plane, and now they do have. But every one of us should think about that in 12 or 16 hours we are not going to have anything, and then we may land up in a country where we don't know anything.
Yeah, actually, 3 times on my flight, I had to look after somebody and divert the plane because somebody was so sick on that plane. Actually, my sister was with me on one of those flights.
It happened to me. We were flying Pan Am, good old days, from Paris to India. So I had to request the captain to land in Tehran because the patient was very sick and we had to call the ambulance. Now, I won't tell you the other side of it.
Lots of it.
The lady was traveling from India. And during the flight, the captain came and he said, "Are you a doctor?" I said, "Yes." The baby, the lady is going to deliver it. I said, "I'm not that kind of a doctor." But anyway, we made the delivery room in the back of the plane and on and on. And
In the end.
in the end, I had to ask Rita to come and help me.
She said, "I don't want any man doctor."
Anyway, so those things do happen on the flight, but not necessarily related to infection. I think that's the point I want to make it.
Yeah.
May not be related to infection. Somebody in fact died during the flight and the body was kept in one side till we landed. Yeah. Any other question? Yes,
One
please.
more question. This is related to chicken pox. Like shingles, if chicken pox is treated immediately, the severity is lower. So they give a tablet, right?
Yeah.
Virax.
Yeah.
Does it have any connection with the shingles later on? Suppressing.
No, so it doesn't. You're right. So if you get chicken pox, you should treat. If you treat early, it cures the disease very quickly, but the virus still becomes latent. So it can still cause shingles later on, so there's no real connection to that. The treatment has no effect on the latent or the dormant form of the virus.
Any other question? Please go ahead. Come on, go ahead.
Is shingles vaccine is safe for somebody who had heart surgery in the past or is having heart problems? Is it okay?
Yeah, that's a good. So shingles vaccine is safe as long as you're not on any immune suppression drugs. So it's a live virus vaccine. So if you're on high dose prednisone, or if you've had a transplant or on chemotherapy, then you can't get the shingles vaccine. But otherwise, for heart patients, it's safe.
Are there any ideal time to visit India then in that case? Because of the dengue fever, there are seasons for it there.
Yeah. All times are good times to visit India, right? So, but if you go during, non-mosquito season, then your chance of getting any of these mosquito-borne illnesses are less. So.
Go ahead. Anand?
Can you please comment a little bit? I know you partially answered about shingles vaccine, the side effects of vaccines in general, all the ones you mentioned, such
Sure.
as pneumonia, shingles.
Yeah. So, overall, vaccines are very safe. All medical interventions have side effects. Antibiotics have side effects. Surgery has side effects. So every medical intervention has side effects. Now, the incidence of side effects with vaccines is much, much lower than the incidence of side effects with just about any other medical intervention. So, but for example, with influenza, there have been very rare cases of something called Guillain-Barré syndrome, which is a nerve damage from the vaccine. But the incidence of those kinds of things is about 1 in a million. So it's very, 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 very low. So it's thought that for all the vaccines, at least that I described, the benefit generally far outweighs any potential risk from those vaccines.
Just a follow-up. Atul, there is so much publicity, vaccine, and autism.
Yeah.
Could you
Yeah, I
comment
can
on
comment on that. Yeah, so years ago there was some research done that suggested that MMR vaccine was linked to autism, and then later on people suggested that certain additives within vaccines were causing autism, and basically all of that data has now been disproven. So all the recent data really strongly suggests that vaccines are not linked to autism. But part of the problem, people thought they were linked because kids get vaccines, at age 12 months, right, or at 2 years or 3 years, and autism, the symptoms start to come out at about that time. So people thought, oh, well, maybe it's due to the vaccine because the timing was similar. But, you could get a vaccine and you could get hit by a car the next day, and you can't say, oh, well, the vaccine caused me to get hit by a car. Right? So it's all about timing, right? So I think I'm very confident, and the entire medical community or 99% of the medical community is very confident that vaccines do not cause autism.
People going to India, are they recommended to have vaccine for hepatitis A, B?
So hepatitis A, you are recommended, but most of us, including myself, are already positive for hepatitis A, so we acquired it during childhood, and so we're immune, and so don't need the vaccine. So you can either get the vaccine, and it's a 100% effective vaccine almost, or you can just get your blood tested to see if you're positive already, and if you're positive, you're protected from life. Hepatitis B is a little bit harder to transmit. You don't typically get hepatitis B from food. You get it from blood products and sexual transmission and things like that. But again, in Canada, universal hepatitis B vaccination is recommended, and it's an extremely effective vaccine.
Is there any place for gamma globulins at any point?
In the past, we used to give a lot of gamma globulin, especially to prevent hepatitis A. But nowadays, the vaccine is so effective that typically it's not necessary.
Any other questions? Yes, please, go ahead.
Once you have lung transplant, then again you have short of breath, then they have to go back to oxygen again?
It depends on what causes the shortness of breath, Auntie. So, but I can talk to you about that after the talk today. Talk to you right after this, okay?
In the audience, without naming, there are people who are liver transplant, there are people who are lung transplant. So I would request meet with Atul afterwards, please. Any other question? Yes?
I know you talked about probiotics. The variety of good bacterial culture, as I read them on the side of yogurt containers, particularly organic yogurt containers, there are now about 10 different kinds of bacteria that is being used. And I'm just wondering if you have any comment in general as to is there an overkill now on that side? And is there any risk to taking some of these things which may not already be present in your gut and may not really be beneficial? But I have counted at least 10.
Yeah, no, that's a good question. There probably is overkill nowadays. Generally, you should eat healthy, basically. And if you eat healthy and live healthy, you don't need probiotics, you don't need this, you don't need that kind of stuff to maintain a healthy digestive tract. I think if you have, if you need antibiotics and things like that, then maybe probiotics are helpful in that situation. But they haven't been really that well studied in big trials or anything like that. And especially all the different kinds of probiotics haven't been well studied.
Can they cause harm?
Can they cause harm? Probably not in most situations. I think anything in extreme excess can certainly cause harm, and especially if your immune system is down because of various illnesses, transplant or chemotherapy or whatever, then certainly they have been shown to cause harm if taken in excess.
So would eating 2 cups of yogurt a day be out of line for
No.
most people?
No, that's fine.
That's fine, thank you.
Even 3 times is okay. Since there are no more questions, and I'd like to again thank Atul the usual way. super talk, very practical, useful for all of us. And thank you, Atul.
Thanks.
I'm glad he still calls me uncle. because there are some youngsters not, they're desperate to call by first name because now they're dead.